The Opioid Response Network, ORN, is a federally funded national initiative that provides education and training in the prevention, treatment, recovery, and harm reduction of opioid and stimulant use disorders. ORN provides educational resources, training, and consultation, acting as a kind of temporary agency, meeting the specific local needs of organizations, communities, healthcare systems, states, and individuals, all at no cost. For more information, visit opioidresponsenetwork.org and the AHA's website at cpr.heart.org. Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or products. In this program, Preparing for an Emergency, you will learn skills that can help you save lives. You will learn how to do CPR or cardiopulmonary resuscitation, and how to use an AED, an automated external defibrillator. In addition, we will include information on what to do if someone has overdosed on opioids and needs naloxone. This medication is now available over the counter and can reverse the effects of an opioid overdose. Finally, you will learn how to stop life-threatening bleeding. Cardiac arrest happens when the heart malfunctions and stops beating unexpectedly. When cardiac arrest occurs, a person's chance of survival falls by 10% for every minute they go without CPR. CPR can help a person whose heart has stopped beating and is no longer pumping blood because of a cardiac arrest. Several issues can cause cardiac arrest. A cardiac arrest can happen because of an electrical issue with the heart that causes an abnormal heart rhythm and blood cannot be pumped to the vital organs. It can also be caused by a heart attack, which is a clot issue where blood cannot flow to the heart because of a blockage in the heart's blood vessels. If a person stops breathing, which can happen with a drug overdose from opioids, that can also cause a cardiac arrest. Extreme blood loss can cause cardiac arrest because the person loses so much blood that their brain and vital organs can't function. Some other causes of cardiac arrest are drowning, electrocution, or severe allergic reaction. CPR is made up of two parts. First, chest compressions, which is pushing hard and fast in the center of the chest. When doing compressions, you act like the heart, helping to push oxygen-filled blood to the brain and the rest of the body. This can help someone survive when their heart stops beating. The second part is breaths. When the heart stops, it causes low oxygen delivery to the body, and breaths help replenish the oxygen. If you cannot provide breaths or feel uncomfortable doing breaths, we will teach you about compression-only CPR, also called hands-only CPR. Hands-only can be used for a teen or adult who suddenly collapses and can keep the blood flowing until help arrives. Remember, hands-only CPR is just the first part of CPR, the compressions. With hands-only CPR, push hard and fast in the center of the chest on the breastbone until help arrives. Remember, some CPR is better than no CPR. In addition to compressions, you may also use a small device called an AED. AED stands for Automated External Defibrillator. It can be used to treat cardiac arrest by delivering an electrical shock. If one is nearby, you should use it in combination with CPR immediately. An AED reads or analyzes the heart rhythm and then tells you if a shock is needed. Many airports, grocery stores, shopping malls, churches, workplaces, and other public places now have AEDs you can use to treat cardiac arrest. Giving CPR immediately and using an AED as soon as it is available can double or triple the chance of survival for a person in cardiac arrest. In some public areas, you may find naloxone, the medication to reverse an opioid overdose, located with the AED. If you think someone may have passed out and stopped breathing from an opioid overdose, you can use the spray or pre-filled syringe to potentially save the person's life. You might think cardiac arrest happens only to older adults, but the truth is, cardiac arrest can happen to anyone. It can happen to a young athlete, a family member of any age, or even a child or infant. During this training, you will have time to practice CPR on an adult mannequin and learn more about CPR on a child and infant. You will also learn about treating opioid overdoses and controlling bleeding. So, let's get started. One of the leading causes of cardiac arrest in younger people are drug overdoses from opioids. Across the United States, more than 2 million people have opioid use disorder. Opioids are highly addictive drugs, and people who misuse opioids are at increased risk of becoming addicted and overdosing. Opioids include illegal drugs such as heroin and manufactured products such as fentanyl. Opioids also include prescription medications such as morphine, codeine, methadone, oxycodone, hydrocodone, fentanyl, hydromorphone, and buprenorphine. It's important for you to know how to respond to this life-threatening emergency. How do opioids work, and why can they cause cardiac arrest? Opioids bind to specific parts of the brain, nervous and digestive systems. They also decrease the body's perception of pain. If the body has too much of the opioid, it can cause its breathing and heart rate to slow down. This lack of oxygen to the brain can cause brain damage even before the person's heart has stopped. So what should you do if you see someone who may have overdosed on opioids? You are likely to encounter the person with the overdose in a home or isolated location where other equipment, such as an AED, may not be present. It's vital that you know how to respond. There's a safe and effective way to help someone with an opioid overdose. Naloxone is a medication that is used to reverse the effects of an opioid and help the person survive. However, it won't work for other types of drug overdoses. But even if someone didn't mean to take opioids, many drugs are laced with opioids without the person knowing it. Naloxone is now available over the counter, meaning no prescription is required. In some public places, naloxone may be stored with an AED or first aid kit. If you know of someone who has naloxone and you are familiar with or have been trained in the use of naloxone, you may use it to save a life. Naloxone comes in several forms. Common forms are an intranasal spray and a pre-filled syringe. You can give naloxone by spraying it into the nose or injecting it into a muscle. Here are some general tips about how to use naloxone nasal spray. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Insert the tip of the nozzle into one of the person's nostrils. Press the plunger to give the entire dose of naloxone. Take the nasal spray out of the nostril. If the person doesn't respond within 2 to 3 minutes or stops breathing, use a new nasal spray to give a second dose of naloxone in the other nostril. Now that you know how to use naloxone, how do you know if someone has overdosed and may need it? Let's review some signs of an opioid overdose. Check to see if the person is hard to wake up, has vomited, or is unresponsive. Listen to see if they have shallow or slow breathing, or even no breathing, or only gasping. Look for signs of the drug nearby or other evidence of drug use, like syringes or powder. Their lips, fingernails, or skin may also look blue, or the pupils of their eyes can be small. Touch them, and you may feel that their skin is sweaty. Any of these can be a sign of an opioid overdose. If you suspect someone has overdosed on an opioid, first, check to see if the person is still responsive. Shout for help, phone 911, get naloxone and an AED, and stay with the person until help arrives. If the person is breathing normally, it's essential to keep them breathing. Be sure to tap and shout, reposition the person to open their airway, and consider giving naloxone. Continue to watch the person's breathing until help arrives. If the person is unresponsive and not breathing normally or only gasping, start CPR, give naloxone immediately, and use an AED if one is available. Resume CPR until EMS arrives. To review, if the person is responding and breathing, phone 911 and get naloxone and an AED if available. If the person is not responding but breathing, phone 911, tap and shout, reposition, and consider giving naloxone. If the person is not responding and not breathing or is only gasping, phone 911, start CPR, give naloxone, and use an AED. Now let's learn the steps of CPR. So let's start from the beginning. Imagine you're in a store when a male suddenly collapses onto the floor in front of you. We're going to teach you exactly what to do. First, we are going to demonstrate, and then you will get a chance to practice. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the person on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the person doesn't respond, you need to get help. Shout to see if anyone is nearby. Say something like, "Help! Somebody help me!" If someone arrives, tell that person to phone 911 now and get an AED and naloxone if available. If no one comes to help you, you'll have to phone 911 yourself. If you have a mobile phone with you, phone 911. Use the speaker mode while you talk to the dispatcher so that you can have both hands free to start CPR immediately. If you don't have a mobile phone, leave the person to phone 911 and get an AED and naloxone if available. Return to the person and quickly begin giving CPR using the AED and administer naloxone as needed. The dispatcher will ask you some important questions, such as what's your exact location, so that they can send help quickly and to the right place. If you're calling from a mobile phone, be very specific about your location so that medical help can find you easily. Don't hang up the phone unless the dispatcher tells you to. The dispatcher should help you remember and guide you through the steps of CPR and how to use an AED and naloxone if available. Once you've phoned 911, you'll need to check if the person is breathing normally. Check for breathing for at least 5 but no more than 10 seconds, looking for the chest to rise and fall. A person in cardiac arrest will not be breathing normally or may only be gasping. These gasps are frequently present in the first minutes after cardiac arrest. A person who gasps usually appears to be drawing air in very quickly. They may open their mouth and move their jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. If a person who doesn't respond, isn't breathing normally, or is only gasping, it's a sign of cardiac arrest and the person needs CPR. We've just demonstrated the steps leading up to CPR. Now, we want you to practice those steps. Use your mannequin to practice along with the video while thinking about how you would use these steps in real life. Remember, you may need to call for naloxone and an AED if you believe the person has overdosed on opioids. You have just found someone lying on the ground. First, make sure the scene is safe. Next, tap and shout. "Hey, are you okay? Are you okay?" Shout for help and practice sending someone to phone 911 and get an AED and naloxone. "Help! Somebody help me! You, phone 911 now and get an AED and naloxone." you're not going to actually practice phoning 911 yourself. Check for normal breathing. Scan the chest for at least 5, but no more than 10 seconds. If the person isn't breathing or is only gasping, they need CPR. Great job. Now you know how to do all of the steps leading up to CPR. Now let's learn how to do the first part of CPR, compressions. Let's get started by practicing using your mannequin. Put the mannequin on the floor and kneel beside it. If you can't kneel on the floor, feel free to put the mannequin on a low table or another firm, flat surface while you practice. To follow along, you will need to be able to see the screen while you're using your mannequin. You may need to clear a space on the floor and reposition it so that you can see the practice video clearly. Let's test your mannequin. When you do CPR, put the heel of one hand in the center of the chest on the lower half of the breastbone, right here. Then put your other hand on top of the first one, like this. Now, push straight down on the chest. Push hard. Listen for a click. Did you hear it? This sound tells you that you're in the right place and that you're pushing deep enough. If you don't hear a click, push harder. You may need to adjust your hands a little to find the spot that makes the chest click when you press down. Keep your elbows locked, it makes it easier. If you're pushing hard and still not hearing a click, check to make sure your mannequin is fully inflated. If you need more time to find the right spot to push and hear the click, keep practicing until you're ready to continue with the course. Now, we're going to teach you how to give compressions. Watch first, then you'll get a chance to practice. We'll start with pushing on the chest. Make sure the person is lying face up on a firm, flat surface, like the floor. To give compressions, kneel beside the person's chest. Quickly move bulky clothes if they are in the way. If a person's clothes are hard to move, leave the clothing alone and push on the chest. If someone brings an AED, you must remove all clothing that covers the chest. I'll tell you more about that when we talk about using an AED. Next, place the heel of one hand in the center of the chest on the lower half of the breastbone and put your other hand on top of the first. Keep your hands in the center of the chest and push straight down. Hard. Keep your arms straight and your elbows locked. Bend at the waist so that you can use your body weight to help you push. For an adult or teen, you'll push the chest down at least 2 inches. That's about the height of a credit card. Push at a rate of 100 to 120 compressions per minute. That sounds fast, and it is. It helps if you push to a beat. Every time you push down, let the chest come all the way back up. When you let the chest come back up completely, the heart can refill with blood between compressions. Be sure not to lean on the chest after you've let it come back up. Do not interrupt compressions for more than 10 seconds. Keep giving compressions until the AED arrives, someone else takes over, medical help arrives, or the person starts to respond. It's important to know that the steps for giving CPR to men and women are the same. A woman is generally less likely to get CPR because bystanders might be afraid of hurting her or touching her breasts. Don't be afraid. Cardiac arrest could kill her if you don't do CPR. Your fingers may come in contact with her breast while pushing on her chest, but focus on pushing in the center of her chest. It's time for you to practice compressions. Although we're just practicing today, you may need to use these skills in the future to save the life of a family member, a friend, or even a stranger. Put the mannequin on the floor and kneel beside it. Put one hand in the center of the mannequin's chest and then put your other hand on top of the first. Keep your hands in the center of the chest and push straight down, hard enough that you can hear the click. Now, listen to this beat. The beat is telling you how fast to push. Compress to the beat. If you're pushing hard enough, you'll hear the mannequin click. Keep compressing to make sure that you know how hard you need to push. If you can't make it click, that's okay. Just push as hard as you can. Now, you're ready to practice compressions. When the music begins, start pushing down hard in the center of the mannequin's chest, making sure you push the chest down at least 2 inches. You should hear the click each time you give a compression. Push fast at a rate of 100 to 120 compressions per minute, and let the chest come all the way back up after each compression. The beat will help you practice pushing fast. Keep giving compressions until the beat stops. Get ready to begin practicing compressions. Push down at least 2 inches. Listen for the click. Keep pushing hard and fast. Let the chest come all the way back up after each compression. Did you hear the mannequin click with every compression? If so, great job. That means you were pushing hard enough to keep blood moving through the body. This is one of the most important steps in hands-only CPR. Congratulations, you've learned how to give compressions. Now we will learn the second skill of providing high-quality CPR, giving breaths. Breaths are vital for infants, children, and anyone in cardiac arrest due to choking, drowning, opioid drug overdose, or other breathing issues. It's a common misconception that humans exhale only carbon dioxide, when in fact, we exhale a number of compounds, including oxygen. This means that the oxygen in your exhaled breaths is helpful to a person who can't breathe on their own. Giving breaths to an adult is the same as giving breaths to a child. The first step in giving breaths is to open the airway. Put one hand on the person's forehead and put the fingers of your other hand under the bony part of the chin. Tilt the head back and lift the chin. Tilting the head and lifting the chin opens the person's airway, which will let your breaths enter their lungs. Now, keep holding the airway open while you pinch the nose closed. Take a breath, cover the person's mouth with your mouth, and give a breath over about 1 second. Watch for the chest to rise as you give each breath. Give another breath. If the chest doesn't rise when you give a breath, let the head go back to its normal position. Then reopen the airway and give another breath. Let's see CPR with breaths performed together. Remember, when giving compressions to an adult during CPR, you need to push the chest down at least 2 inches. Make sure the person is on a firm, flat surface like the floor. You need to push fast at a rate of 100 to 120 compressions per minute and let the chest come back up completely after each compression. Provide 30 compressions, then 2 breaths, and continue doing this until help arrives. Remember, if you are uncomfortable giving breaths, provide hands-only CPR until help arrives. Some CPR is better than no CPR. Giving CPR right away increases the chance that a person will survive a cardiac arrest. You've learned that it's important to get an AED if one is nearby. Now let's discuss why. An automated external defibrillator, or AED, can be used to treat cardiac arrest by delivering an electrical shock. If one is available, have someone phone 911 and bring you the AED. AEDs are often mounted on walls and have visible signs posted near them to help you locate them. By the end of this section, you'll be trained on how to use an AED. Using an AED is safe. It won't shock someone unless they really do need it. Once an AED arrives, use it immediately. You only need to remember to turn it on and follow the prompts. Once you turn it on, the AED will tell you everything you need to do. Some AEDs will turn on automatically when you lift the lid. Others will require you to push the on button. After that, just follow the prompts you see and hear.
Attach pads to patient's bare chest.
You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads should not be placed over any clothing. AEDs may have two sets of pads, adult pads and child pads. Make sure you use the adult pads for anyone 8 years or older.
Plug-in pads connector. Analyzing heart rhythm.
Pause to let the AED analyze. Loudly state, "Clear," and make sure that no one is touching the person. The AED will analyze the heart rhythm. If the AED tells you that a shock is not needed, immediately resume CPR.
Shock needed.
Loudly state, "Clear," and make sure that no one is touching the person before you press the shock button. Then press the button to deliver a shock.
Shock delivered.
Once a shock is given, immediately resume CPR. Some special situations can affect how you should place the AED pads. Before you apply the pads, quickly scan the person and assess the situation to check for any of the following. If the person is lying in water, quickly move the person to a dry area. If the person is lying on snow or in a small puddle, you can use the AED. The chest doesn't have to be completely dry. If the chest is covered with water or sweat, quickly wipe it before attaching the pads. If the person has an implanted defibrillator or pacemaker, there would be a bulge under their skin near where the pad would need to go. Don't put the AED pad directly over the implanted device. If there is a medicine patch where you need to place an AED pad, don't put the AED pad directly over the medicine patch. Using protective gloves, remove the medicated patch, wipe the area clean, and attach the AED pads. If the person has a hairy chest and the AED pads don't stick well, quickly shave the area where you will place the pads by using the razor from the AED carrying case. If no razor is available, use a second set of AED pads, if available, to remove the hair. Apply the pads and press them down firmly, and then rip the pads off forcefully to remove the chest hair. Reapply a new set of pads to the bare skin. Undergarments such as bras should be removed along with other clothes covering the chest because they often interfere with proper pad placement. If a woman has large breasts, her breasts may fall to the sides once you remove her bra to apply the AED pads. You may need to lift the left breast to place the pad under it. Use an AED for a pregnant woman in cardiac arrest as you would for any person in cardiac arrest. Shock from the AED will not harm the baby. You don't need to remove a person's jewelry as long as it does not interfere with the placement of the pads and is not in contact with the pads. It does not cause a shock hazard to either the person or the rescuer. Here's your chance to practice using the AED simulators. Push the on button.
Attach pads to patient's bare chest.
Follow the diagrams on the pads to place them on your mannequin's chest.
Plug-in pads connector. Analyzing heart rhythm.
Pause to let the AED analyze. Loudly state, "Clear," and make sure that no one is touching the person. The AED will analyze the heart rhythm. If the AED tells you that a shock is not needed, immediately resume CPR. If a shock is needed, the AED will tell you.
Shock needed.
Loudly state, "Clear," and make sure that no one is touching the person before you press the shock button. Then press the button to deliver a shock.
Shock delivered.
Immediately resume CPR. Believe it or not, using a real AED is just as easy as using this one. All you have to do is turn it on and follow the prompts. Now we will demonstrate how to put it all together, from scene safety and assessment, to providing compressions and giving breaths, to using an AED and naloxone. First, make sure the scene is safe. Next, tap and shout. "Hey, are you okay? Are you okay?" If the person doesn't respond, shout for help. "Help! Somebody help me!" Ask someone to phone 911 and get an AED and naloxone if available. You, phone 911 now and get an AED and naloxone. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Give 30 chest compressions. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm.
Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says it is needed.
Shock needed.
Loudly state, "Clear," and make sure no one is touching the patient before you press the shock button. Then press the button and deliver a shock.
Shock delivered.
Immediately resume CPR. Now you have learned how to perform CPR on an adult. In the optional modules, you can learn how to perform CPR on a child and infant. In this final section, you'll learn what to do if someone is bleeding. You'll also learn about first aid kits, how and when to use bandages and dressings, and how to pack a wound and apply a tourniquet. It's a good idea to always have a first aid kit handy, so keep one first aid kit at home and one in your car. A first aid kit has things you may need to give first aid and stop bleeding. Some of these things are gloves, gauze dressing, bandages, and a manufactured tourniquet. A gauze dressing is a clean material placed directly on a wound to stop bleeding. If you don't have a first aid kit, or if your kit doesn't contain gauze dressings, you can use any other clean piece of cloth. A bandage is a material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressing in place over a wound with a bandage. A tourniquet is a band of cloth or rubber. You wrap it around the person's injured arm or leg and then pull it tight. This squeezes the blood vessels to help stop bleeding. Tourniquets come in several different styles, so you should become familiar with the ones that might be in your kit. Now let's determine if this is minor or major life-threatening bleeding. With all bleeding injuries, your first action should be to identify 2 factors to guide your care: the amount of bleeding, the location of the bleeding. Most of the time, bleeding is minor. That means you can treat it without help from a doctor. Small cuts or scrapes can cause minor bleeding. An adhesive bandage can often stop minor bleeding. What if the bleeding from a cut or wound is not minor? In that case, simple bandages may not be enough to stop the bleeding. Major life-threatening bleeding is when blood continues to flow from the wound and a large amount of blood has been lost. A large amount would be about 6 ounces or more. 6 ounces is about half of a beverage can. Many types of injuries can cause life-threatening bleeding. Some examples are car accidents, cuts from broken glass, accidents with tools, and falls from a height. Stabbing with a knife or shot with a gun can also cause life-threatening bleeding. You do not want to wait for the blood to accumulate to take action, because cuts that seem moderate at first can become severe. This can happen when the person is taking certain types of blood-thinning medications, like aspirin. It's essential to watch for how much blood the person is losing so you can provide first aid as soon as possible. Be prepared to take action. You should always phone 911 first when there is life-threatening bleeding. Here are the steps to help anyone who is bleeding. First, make sure the scene is safe. Be sure you and the injured person are safe from whatever caused the bleeding. Then, send someone to get the first aid kit. Try to stay calm when someone is bleeding. Bleeding often looks worse than it is, and simply applying pressure can stop most bleeding. Ask the hurt person to apply pressure to the wound if they can. Now, quickly get supplies. Put on gloves as soon as you have them. For an injury with minor bleeding, wash the area with soap and water and apply a dressing to the wound. When the wound stops bleeding, place an adhesive bandage over the dressing. This is a proven way to help wounds heal faster and better. The hurt person might need stitches or even a tetanus shot, so they should go to a doctor as soon as possible. What if the bleeding continues? This could be major life-threatening bleeding. 3 ways to help stop the bleeding are direct pressure, packing the wound, or applying a tourniquet. Direct pressure can be used for wounds that are minor and continue to bleed, or wounds that are possibly life-threatening. First, use the heel of one hand to press down on the dressing. Put your other hand on top of the first. Try to keep your arms straight as you press down firmly. Direct pressure should be firm, steady, and constant. Keep pressing and don't stop to add more dressings. And don't take a dressing off once it's in place. Doing this could cause more bleeding. If the bleeding does not stop, press harder. Keep pressing down firmly until help arrives or the bleeding stops. If you stop pressing too soon, the wound might bleed again. Once the bleeding stops, wrap a bandage over the dressings. Make sure it's firmly in place. You can also do this if you're not able to keep pressing down. The bandage will keep the dressings from moving. There are special dressings that sometimes help stop bleeding. They are called hemostatic dressings. They contain a material that helps blood to clot so that it stops flowing. Most home first aid kits don't have these dressings, but it's good to know about them. What if the bleeding still doesn't stop? Then you need to pack the wound and apply direct pressure. Packing the wound means pressing material tightly into the wound. Use gauze or a clean cloth to do this. Then apply direct pressure on the wound until help arrives or the bleeding stops. Pack any life-threatening wound, including the head, neck, chest, or abdomen. Apply a tourniquet if direct pressure and packing the wound do not control the bleeding. Manufactured tourniquets can only control life-threatening bleeding on arms or legs. There are many types of tourniquets. Let's learn how to use the windlass rod type. First, Place the tourniquet 2 to 3 inches above where the arm or leg is bleeding, on the side of the injury closer to the heart. Never put a tourniquet on a joint, such as a knee or elbow. Instead, go above the joint if needed. Next, pull the free end of the tourniquet to make it as tight as possible. Then secure it. Now, twist the windlass or knob until the bleeding stops. You must twist the windlass as tight as possible to stop life-threatening bleeding. This will often cause pain, but it will slow blood loss. Finally, secure the windlass. Write down what time you applied the tourniquet. If the person keeps bleeding after you placed a manufactured tourniquet, add a second manufactured tourniquet. Place it above the first one on the side closer to the heart. Write down what time you applied the second tourniquet. Once you have the tourniquet in place, leave it alone until someone with more advanced training arrives and takes over. You have learned the steps to control bleeding and possibly save a life. The AHA is part of the Stop the Bleed National Awareness Campaign to help minimize injury and death caused by blood loss. Stop the Bleed encourages bystanders to become trained, equipped, and empowered to stop or reduce severe bleeding before professional help arrives. If you want more information on this campaign, including additional resources, visit stopthebleed.org. People often use the terms cardiac arrest and heart attack to mean the same thing, but they are not the same. The major difference between the two is that during a heart attack, the heart still beats and pumps blood, and the person is still alive. When the heart stops beating, the person is in cardiac arrest. During cardiac arrest, the heart is not beating, and the person does not respond and does not breathe normally. Cardiac arrest is a rhythm problem. It occurs when the heart malfunctions and stops beating unexpectedly. A heart attack is a clot problem. It occurs when a clot blocks blood flow to the heart. The longer the person with a heart attack goes without treatment, the greater the possible damage to the heart muscle. Typically during a heart attack, the heart continues to pump blood, so the person doesn't need CPR. Occasionally, the damaged heart muscle triggers an abnormal rhythm that can lead to cardiac arrest. Cardiac arrest results from an abnormal heart rhythm. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate CPR. A heart attack isn't the only thing that might cause cardiac arrest. Severe injuries, drowning, and drug overdose can also cause cardiac arrest. Just remember, when a person's heart stops beating for any reason, that person is in cardiac arrest and needs CPR immediately. It's really scary to see someone whose heart has stopped beating, but if you phone 911 and start CPR immediately, you can help save that person's life. Before we get started, let's talk about what we mean when we say child. For the purposes of giving CPR, a child is anyone older than 1 year, but not yet a teenager. If you're unsure of the child's age, treat anyone that looks like a teenager as an adult. Children usually have healthy hearts. Cardiac arrest in children often results from breathing problems, but it can also be caused by drowning, severe injury, poisoning, and other problems that cause low oxygen delivery to the body. For this reason, giving breaths with compressions is essential when giving CPR to a child. Giving breaths to a child is the same as giving breaths to an adult. The first step in giving breaths is to open the airway. Put one hand on the person's forehead and put the fingers of your other hand under the bony part of the chin. Tilt the head back and lift the chin. Tilting the head and lifting the chin opens the person's airway, which will let your breaths enter their lungs. Now, Keep holding the airway open while you pinch the nose closed. Take a breath, cover the person's mouth with your mouth, and give a breath over about 1 second. Watch for the chest to rise as you give each breath. Give another breath. If the chest doesn't rise when you give a breath, let the child's head go back to its normal position. Then reopen the airway and give another breath. When giving compressions to a child during CPR, you need to push the child's chest down about 2 inches, or at least 1/3 the depth of the chest. For a child, you can use 1 or 2 hands to give compressions. Use the number of hands necessary to push the child's chest down about 2 inches. Much of the rest of child CPR is the same as adult CPR. Make sure the child is on a firm, flat surface, like the floor. You need to push fast at a rate of 100 to 120 compressions per minute, and let the chest come back up completely after each compression. Many of the steps you learned in adult CPR will be the same in child CPR. Make sure the scene is safe. Tap and shout. Shout for help. Send someone to phone 911 and get an AED. Check for breathing, and begin sets of 30 compressions and 2 breaths. If no one comes to help you and you don't have a mobile phone nearby, complete 5 sets of compressions and breaths, and then leave the child to phone 911 and get a nearby AED. The key difference between adult and child CPR is that if you're alone, you stay with the child and give 5 sets of compressions and breaths before leaving to phone 911 and get an AED. Early CPR provides the child with much needed oxygen immediately. Watch closely while we demonstrate the entire child CPR sequence. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the child on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the child doesn't respond, you need to get help. Shout to see if anyone is nearby. Say something like, "Help! Somebody help me!" If someone arrives, tell that person to phone 911 now and get an AED if it's nearby. If you have a mobile phone with you, phone 911 yourself. Use the speaker mode on your mobile phone so you can have both hands free to start CPR immediately. Remember to stay with the child. Check for breathing for at least 5, but no more than 10 seconds. Remember, if the child isn't breathing or is only gasping, it's a sign of cardiac arrest and the child needs CPR. Give sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if you're alone and no one has phoned 911, leave the child to phone 911 and get a nearby AED. Continue CPR until the AED arrives, medical help takes over, you physically can't continue, or the child starts to respond. Remember, when a child's heart stops beating, an automated external defibrillator, or AED, can be used to deliver a shock. You've already learned how easy it is to use an AED. You only need to remember to turn it on and follow the prompts. When using an AED on a child, use the child pads if provided, or the child key or switch if the AED has one. If there are no child options, use the adult pads. There are pictures on the child pads that show where to place them. When you put the pads on the child's chest, make sure they don't touch each other. AEDs are safe to use on children, and they could save a child's life. If a child needs CPR and there's an AED available, use it. Now we're going to teach you how to give infant compressions. Make sure the infant is lying face up on a firm, flat surface. Quickly move bulky clothes out of the way of the infant's chest. If the infant's clothes are difficult to move or remove, leave the clothing and begin pushing on the chest. Put 2 fingers of one hand in the center of the chest, on the lower half of the breastbone, just below the nipple line. Now, push straight down. Push the chest down approximately 1.5 inches. Pushing at the correct depth is essential, as is pushing at the correct rate. Push at a rate of 100 to 120 pushes per minute. Every time you push down, let the chest come all the way back up. When you allow the chest to come back up completely, the heart can refill with blood between pushes. Another way to push on the infant's chest is to use your thumbs instead. Place both thumbs side by side on the breastbone, just below the nipple line. Wrap your fingers around the infant's chest and support the infant's back. Push down approximately 1.5 inches or 1/3 the diameter of the infant's chest. You can also use the heel of one hand if needed to get to the proper depth. Make sure to let the chest come all the way back up after each push. Great job. Now let's learn how to give breaths. For this course, an infant is anyone younger than 1 year of age. Just as in adults and older children, when an infant's heart stops beating, blood stops flowing through the body. Most infants often have healthy hearts, but even an infant's heart can stop beating if they can't breathe or have trouble breathing. It's important to give breaths to an infant who needs CPR. To give an infant breaths, you first need to open the airway. Place one hand on the infant's forehead and the fingers of your other hand on the bony part of the chin. Tilt the head back and lift the chin. Be careful not to press on the neck and don't tilt the head back too far. While holding the airway open, take a normal breath and cover the infant's mouth and nose with your mouth. Blow for about 1 second. Watch for the chest to rise as you give each breath. If the chest doesn't rise when you give a breath, let the head go back to its normal position. Then try opening the airway again by tilting the head back and lifting the chin. Give another breath. If you can't get the chest to rise within 10 seconds, go back to pushing on the chest. Remember, when doing CPR on an infant, you'll provide 30 compressions and then give 2 breaths. Keep providing CPR until the infant starts to respond or medical help arrives and takes over. If you are alone and don't have a cell phone, give 5 sets of compressions and breaths before taking the infant with you to find a phone and call 911. If the infant is injured, leave them to find a phone and call 911. Congratulations! You've learned some valuable skills today, as well as why it's so important to know CPR. The life you save might be someone you know and love. You can make a difference when someone needs it most. Your CPR and First Aid Anywhere kit contains more information and topics not covered in this training. Use your Anywhere kit for more hands-on practice with the adult and child CPR sequences. Please spread the word about CPR, AEDs, opioid overdose response, and Stop the Bleed to your community. Talk to local organizations and businesses about hosting CPR training and making AEDs, naloxone, and Stop the Bleed kits more available. For more information, go to cpr.heart.org.